I am Dr. Chandrakant Thatte. My age is 74 completed. At present, I am a retired person. We have one son who is an advocate, and his wife is also an advocate. Both of them are practicing. My wife also used to practice as a dental surgeon for around about 35 years. Now she is retired, I am also retired. My wife is from the doctor's family. All doctors, Talwalkar, are her maternal uncles. And so she has a base of doctors. I have a base of my legal, because my father was a solicitor, my brother is a solicitor. I am a professor by profession. I am BSc, STC, MA, MEd, MPhil, and besides that, I've had an interest in photography. So I did commercial photography from JJ Institute of Applied Arts, and then I was teaching in JJ's School of Applied Arts, where I am the first person who started videography in JJ Institute of Applied Arts. My major service is in St. Teresa's Institute of Education, where I served for more than 30 years, around about 30 years, and thereafter I was called by Professor Javed Khan to start a college, B.Ed college. The name of the college was Oriental College of Education, and then thereafter I was also founder principal of MCA College, Mumbai. So there are two B.Ed colleges which have been started by me in Bombay. Actually, I was to go to Darjeeling on a tour with the Kesaris and all that, but I had a brownish urine, and so I phoned to my family doctor. He said, immediately you get it examined. So he sent a person to my place at about 10 o'clock, a pathologist, and he diagnosed me as brownish. So he told me that please don't go tomorrow, because next day I was to fly to Darjeeling. So I stopped over there, and then I was admitted in Dhanvantari under Dr. Pradeep Talwalkar. There I was around about 3 weeks, and then he found that there is a constriction in the bile duct, and he said because of that you have a jaundice, and so we put the stent by Dr. Phadke, and then again I was after 2-3 days I was quite okay, but thereafter I again found that I had the brownish urine, and so they found that the stent was slightly stripped from the place, and then I had gone to Leelavati Hospital to see Dr. Jagannath, and then Jagannath told me that we will first operate and find out exactly, because there was no tumor inside, that was not at all like in the USG, and so he examined, and then he operated me on 8th of June 2010, and the operation went on for about 3-4 hours, and actually before the operation also I was quite okay except the brownish urine, and thereafter in the hospital I was about 3 weeks, and then he advised me to go to Dr. Bowman for chemotherapy, and then we started chemotherapy. I had 2 cycles of chemotherapy, and the first one was okay, and then my marker, that was CA 19.9, reduced to within the normal limits of 0 to 37. But after that again I found that the limit was marker was exceeding, and so again second cycle of chemotherapy was given to me. Then Dr. Bowman asked me to wait for 3 months, and after 3-4 months, instead of 3, it was my mistake, instead of 3 months I came to Dr. Bowman after 6 months, and it was found that my marker was 2000, means CA 19.9 was 2558. And so he said that there is a latest drug, Abraxane, so we can try it out. I said, I don't mind. Then we tried the Abraxane in addition to the earlier medication. And then we found that the Abraxane gave me a very good result, and within 1.5 months, it reduced from 2558 to round about 43. and then the cycle was continued for 6 rounds, and it came down to 16.8. And 16.8, after 16.8, sir said that we'll wait now. And after that, about a month, again I did 19.9 about 3-4 days back, and it is now at present it is 26.8, which is considerably within the normal limits. Now the next about the next procedure, Dr. Bowman will decide. The primary caretaker of mine is my Mrs. Dr. Ujjwala Thatte. We got married about 45 years back, and our marriage is not a love marriage, it is a usual marriage. And when we married, that time I was only BSc and she was a doctor, but somehow we are doing it very well for the last 44 to 45 years. I have one son who is an advocate, and his missus is also an advocate, and they are also from very good families. My son is, and my daughter-in-law, both of them are practicing in advocate, and being so highly educated, they take care, and I do not find anything left out or ostracized because of this type of a disease. So I am very, very happy with them, and I pray God that let others also have this type of relatives.
आम्ही खरं दार्जिलिंगच्या वगैरे ट्रिपला जाणार होतो, आणि नेमकं आदल्या दिवशी ताप आला, आणि त्यामुळे डॉक्टरांनी सांगितलं आता काही उद्या तर काही लगेच जाता येणार नाही, नंतर जाऊया म्हणून, म्हणजे नंतर तुम्ही जाऊ शकता. आणि युरिन तपासायला दिली, आणि त्याच्यावरनं समजलं की काही इन्फेक्शन आहे, आणि त्यामुळे ती ट्रिप तर कॅन्सल झाली. पूर्ण जेव्हा डायग्नोसिस समजलं की आता बाबा कॅन्सर आहे, त्या पहिल्यांदा अर्थात सर्वांच्या प्रमाणे थोडी भीती वाटली, पण काही झालं तरी कुठलाही रोग असला तरी त्याच्यावर जर डॉक्टरांचे उपचार आपण बरोबर घेतले, डॉक्टरची ट्रीटमेंट बरोबर घेतली, तर आपण व्यवस्थित त्याच्यातनं पार पडू शकतो, ही माझ्या मनाची पहिल्यापासून धारणा असल्यामुळे ती भीती लगेच गायब झाली, आणि नेहमीप्रमाणे रोजचं आयुष्य सुरू झालं. ऑपरेशन झाल्यावर सुद्धा ते 10 दिवस अर्थात आमच्या सुनेचा पूर्ण पाठिंबा असल्यामुळे मी सुद्धा 10 दिवस त्यांच्या बरोबर, म्हणजे मिस्टरांच्या बरोबर दवाखान्यात होते. घरची काही काळजी मला नव्हती, आणि त्यामुळे ते 10 दिवस व्यवस्थित पार पडले. घरी आल्यावर सुद्धा आम्ही दोघेही जणी बरोबर त्यांची काळजी घेत होतो. मुख्य म्हणजे औषधाच्या वेळा सांभाळणं, कारण औषध वेळेवर घेतलं पाहिजे. मी स्वतः डॉक्टर आहे, त्यामुळे अर्थात औषधांवर माझा विश्वास आहेच. ते सगळं व्यवस्थित पार पडलं. नंतर ज्या वेळेला डॉक्टर बोमनकडे, आमच्या फॅमिली डॉक्टर, त्यांनी डॉक्टर बोमनचं नाव सुचवलं की त्यांच्याकडेच तुम्ही जा, आणि त्यामुळे इकडे आल्यावर हे किमोथेरपी सुरू झाली. त्याचा अर्थात पहिले 1-2 दिवस जरा अन्नावरची वासना उडणं, थोडं व्हॉमिटिंग होणं, हे परिणाम होते, पण हे पहिल्यापासून माहिती होते, त्यामुळे त्याच्याकडे जास्त लक्ष न देता आधीपासून जेवताना काळजी घेऊन पाहिजे ते औषधं आधी द्यायची, म्हणजे त्यातल्या त्यात तरी जेवण चांगलं जाऊन व्यवस्थित त्याचे सगळे त्याचे फायदे सगळे दिसायला लागले. पहिलं मला वाटतं 2010 साली 3 सायकल्स झाल्या, आणि त्यामुळे ह्याचा जो इंडिकेशन आहे CA 19.9 ते नॉर्मलला आल्यावर किमोथेरपी बंद झाली. नंतर आम्ही परत जी आमची ह्याची ट्रीप राहिली होती ती त्याच्यानंतर आम्ही परत दार्जिलिंगला जाऊन आलो, आणि त्यामुळे अर्थात पूर्णपणे मनाचं समाधान झालं की कुणालाही काहीही कुठलाही रोग झाला तरी अजिबात घाबरता कामा नये. तुमचा कुडा एक तर देवावर आपली श्रद्धा आहेच, तसंच डॉक्टर म्हणजे देवच आहे, त्या डॉक्टरावर श्रद्धा ठेवून त्याप्रमाणे तुम्ही जर व्यवस्थित उपचार सगळे केलेत, तुम्ही त्याच्यातनं पण बाहेर पडू शकता. 2010 साली ऑक्टोबर मध्ये किमोथेरपी पहिली 6 सायकल्स पूर्ण झाली. त्याच्यानंतर खरं म्हटलं तर वर्षभराने लगेच ते CA 19.9 करायचं होतं, ते आम्हाला थोडा उशीर झाला, आणि त्यामुळे तो जरा जास्त झाला होता आणि म्हणून परत किमोथेरपीची सुरुवात केली. तेही व्यवस्थित डॉक्टरांनी सांगितल्याप्रमाणे त्यांच्या वेळेला येऊन त्यांनी सांगितल्याप्रमाणे सगळी पथ्य पाळून हे केल्यामुळे त्याच्यातनंही पार पडलो. आणि आता मार्च 2013 पासून परत सहा सायकल झाली आणि आता तो CA 19.9 हा अगदी नॉर्मलला आलेला आहे. आणि त्यामुळे जर आपण डॉक्टरवर विश्वास ठेवून त्यांच्या सूचना सगळ्या पाळून जर व्यवस्थित आपली ट्रीटमेंट चालू ठेवली तर कुठलाही रोग असाध्य आहे असं मला काही वाटत नाही. आणि त्यामुळे जे जे डॉक्टरांनी सांगितलं असेल, पेशंटनी कितीही जरी हे करू नको ते करू नको, मला आता बाहेर जायचंच आहे, ह्यानी त्रास होतो असं म्हटलं तरी थोडासा सगळ्यांनी धीर देऊन, आणि मी स्वतः समाधानी आहे, माझी तशी लकी आहे की आम्हाला सून पण चांगली मिळाली आहे, मुलगा तर आहेच, आणि पेशंटही स्वतः त्याच विचाराचा आहे, त्यामुळे सगळं व्यवस्थित पार पडले.
Actually, when a person knows that he is diagnosed as a cancer, practically the person halfway is dead. But that was not the case in my, because I, being a science student, I say everyone is to die some or the other time. So I was not at all afraid of anything. And my life was full. That time I was around about 70 when I was diagnosed as the cancer patient. I say my job is to fight against this type of a disease with the help of doctors and with the help of RDs from different companies. And whether it is going to help me or that we can see. So I said no, I'll get first operated, and the operation was successful. It was done by the one of the most leading person, Dr. Jagannath. And that after the operation, I am under the treatment of Dr. Bowman, and practically till today there is nothing wrong with me. Dr. Bowman used to ask me, how are you? I say, sir, I can run faster than you. So that is my physical condition at present. There are some effects of chemotherapy, no doubt, but first survival is more important than any other thing. Or in Hindi we say that the sar salamat to pagdi pajas. So that is the thing in my mind. I say that some effects or the side effects of the things are there, but whatever that is there, first you survive, and then the other things are possible. And so I have been I am getting the treatment from Dr. Bowman for around about 2.5 years to 3 years, and at present I am quite okay. I work at least in these days also I work not less than 6 to 8 hours. I do my work. I do not sit at home. I go alone everywhere. And my family members, they don't allow me to go. Even then I go, I say my confidence should help me to go and should give confidence to others, those who are suffering from this type of deadliest diseases.
When Dad was first diagnosed with cancer, obviously we were all concerned about his health. That was very natural for us. But we sat together, we discussed with my mom-in-law, who herself is a doctor. So our prime motive was to give best treatment to Dad, and we were always together, and our prime motive was to how to help him to recover after the operation itself. And the best part was that we were always with a team of good doctors, so the guidance was perfect, and we had full faith with whatever doctor was suggesting us. I think that is the most important thing, that one conviction one should have, that doctor is a god to us. So if we believe in ourselves and in doctor who is giving treatment to us, I think one is able to survive, and with a family support, I think cancer is it should not be considered as a deadliest disease, what is the perception is. So this is my experience, and every family member is important to us, no doubt about it. But for me, dad is like my own dad. It's not like that I am his so-called daughter-in-law. He has loved me so much that there was no other way to look at it, that whatever best we can do, we have to do for him, and I don't think so anything great we have done. So in a family like this is, I think, what we can do best, which has been achieved, and with best treatment and full conviction, I think he is doing well. When dad was put on a first stent, he was discharged, and after 2-3 days he developed, I think, some infection. I was at home, mom was also there, and Shashank was in the office. So he vomited, and I was really panicked. I immediately contacted my doctor. He said that you will have to immediately come to the hospital and let me know what has happened really. So we rushed back, and then we were advised to admit him again in the hospital, and he also cooperated, I think, which is the best part, that he never panics, and whatever advice has been given by the doctor, he follows that perfectly. So we admitted him, and he was operated, and everything went very normal, and now you can see how he is with us, full of energy, and we are really happy together.
I'm the luckiest person that I got such a good family. My wife, my son, my daughter-in-law, and my 2 grandchildren, they're helping me like that. I never feel that I'm alone, and I feel that such type of family should be there to support. Then and then it is possible for everyone to bear with this type of diseases. And so I feel that all those who are suffering from this thing should not feel only that their family member should help them, so that half the disease is over if the family support and the doctor support is there. I'm 75, but I don't feel that I am sufficiently old. I feel that I'm just a boy of say 20-25, and I still feel that working 6 to 8 hours a day, one should try every time as long as it is possible. I have got a shop, photo shop, and so I go to the shop and I try to spend my time over there and try to do some work whenever I go. Very recently I have purchased one plotter which is costing me about 3 lakhs of rupees, and with that I am trying to utilize my intelligence, if at all I have, for the betterment of the people. And when I came to know that you people are going to help me out in this thing, I say, so let me help the people who are suffering from these dreadless diseases. They should not feel that they are ostracized, that they are away from the normal life. I am having totally a normal life with the medication, but
Dr. Chandrakant Thatte is a very old patient, and now what chemotherapy he has received, that is the 3rd line of chemotherapy. And besides being physically strong and capable of taking the 3rd line, I feel that mentally he is a very strong person, and his confidence in us has helped us to treat him better. That has complemented his treatment. Otherwise, patients at this stage in the 3rd line are not so cooperative, but he has given us strength to help him. And when he comes for chemotherapy over here also, we don't feel that he is our patient, or he also does not feel. He starts talking to people, he mixes with our staff, and he makes us comfortable, and the treatment goes very smoothly. Besides that, he is always guiding us, and he always gives us his very important comments on certain things, which we always take it in the right sense.
I have read in paper, Sharad Pawar has stated that, who says that cancer kills a person. He said, I am having cancer for last about 7 to 8 years, but I am okay. That helped me to understand, actually with the medication you can have a prolongation of life, so one should not be afraid of. Only the thing is that, and especially the person who has crossed 70 should not be afraid of all these type of diseases. Something is going to happen to anybody, whether it is a cancer or any other disease. And so I feel that one should not be afraid of this type of disease, but one should not give up the hope. They should go on trying their level best to get the maximum help from the doctors, so that the disease can be under control. I do not know whether it is curable or not, but one thing is definite, that this disease is under control with the help of medication, especially the chemotherapy.